Now to the trouble that surrounds a Mid-Michigan death investigation services company. It continues. A forensic pathologist is quitting, and it's not clear how this will affect the company. Our Terry Camp is joining us here in the studio. And Terry, you've been reporting on the Michigan Institute for Forensic Science and Medicine for years now. What impact could this have on the company?
Well, Dawn, it's not clear at this point. The forensic pathologist has sent an email to the county's MIFSM, still serves, and to law enforcement agencies explaining why he's quitting. But the owner of MIFSM says he's still very much in business.
This has been broken promises, chaos, and mayhem.
All of that is spelled out in his email. ABC 12 News has obtained an email sent to the counties who still use the Michigan Institute of Forensic Science and Medicine for its death investigation services.
This organization was fired by Tuscola, then they were fired by Aranac, then they were fired by Saginaw.
The remaining 3 counties in our area that still use MIFSM may have to look for services elsewhere, as Dr. Roshan Mahabir has announced he's resigning, leaving the company without a forensic pathologist and medical examiner. In the resignation email, he wrote, "For the past year or more, I've been missing multiple salaries. I recently found out that for most of this year, we had no health insurance, even though I understand it has been taken out of our checks." Those were claims from past employees we've interviewed. Mahabir continued saying, "I feel exploited and like the American dream has been taken from me." He added, "It would seem we all put our hopes in the wrong people." In a follow-up email, he wrote, "I am really sorry that we are all involved in this." The company is operated through Michigan Health Clinic, which is owned by Dr. David Stockman, who has been the target of several lawsuits.
Dr. Mahabir is a good man. He's respected in the community.
Dr. William Maroney is the medical examiner for several mid-Michigan counties. The promise of MIFSM was to create a regional entity to handle death investigation services, even training forensic pathologists, which are needed in the state. But Maroney says the private venture is not working.
Public health is not profitable. It's done because we need to do it for the families, for law enforcement, and to give people an early warning system for things like bird flu, COVIDs.
Can MIFSM survive?
No.
Now, I did speak with Dr. Stockman this afternoon, and he did release a statement saying, in part, Dr. Mahabir and the Michigan Health Clinics are actively and currently working towards an amicable resolution and continue to provide MIFSM with coverage of the counties for the medical examiner services for the foreseeable future. Unfortunately, there are competitors in the field who are desperate for business and attention, largely because they lack the full range of services we provide. Mahabir's resignation is supposed to take effect at the end of the month.